Okay, today, now I'm going to assess your nose and throat. And first we're going to start external, and then we're going to feel for anything kind of sticking out, any masses, anything abnormal. Do you feel any pain in your nose or throat? Okay. Next we're going to test the patency of your nose. Just give me a second. Okay. So close your eyes and hold one nose closed. Okay, can you smell this? And what is it?
Alcohol.
All right. Okay, now if you'll do me a favor and close one nostril and breathe really deeply in with the other. Okay, and do the same. All right. Next we're going, that was your cranial nerve 1. Next we're going to inspect the mouth. So if you will open up and let me check the mucosa. Everything's nice and pink like it should be and very moist. Okay, and now we're going to, let me observe your teeth. I see some, I don't see anything really bad, so you're good there. Okay, and next we're going to stick your tongue out. And can you move it side to side? Okay, that is cranial nerve 12. Okay, now swallow for me. And I would use a tongue depressor, and we're going to open up. And I would stick it in, and I would assess your gag reflex. Okay, and that's cranial nerves 9 and 10. Okay, alright, now I'm going to inspect your neck, and I'm going to feel for your lymph nodes. First I'm going to just look. So if you will look that way, okay. I don't see anything abnormal, no lesions, no swelling. I also don't see any distension. So, no jugular distension on either side. Okay, now I'm going to palpate for the carotid pulse on both sides. Very strong pulse. Not as strong on that side. Okay, next I'm going to auscultate with my stethoscope, with the bell of my stethoscope for bruits. Okay, and if you hold your breath for me. Alright, take a breath and hold it again. Alright, nothing abnormal. Now I'm going to palpate the trachea. So I'm just going to run it along the side here. Do you feel any tenderness? Okay, and then I'm also going to palpate the thyroid. So if you'll swallow while I do this, swallow. Feel any tenderness? Nothing. I didn't feel any swelling. So now we're going to do range of motion. So if you'll turn your head this way, back, chin to chest, and a big circle. And shrug your shoulders. That's cranial nerve 11. Okay, last I'm going to do the lymph nodes. So we've got preauricular, posterior auricular, occipital, submental, submaxillary, deep cervical chain, superficial cervical, posterior cervical, and supraclavicular. And retropharyngeal will be deep down inside. So I don't feel any swelling at all, so you're good. I'm done.
Okay, Susan, now we're going to check your neck and your lymph nodes, and I'm going to start by just looking at the external surface of your neck. Do you feel any tenderness when I do this? And can you turn your head to the right? This is checking for distension of your jugular vein and also checking for your range of motion. So turn your head to the left or your right. No distension, range of motion's fine there. And now I'm going to check for your carotid pulse. Okay. Okay, that's good. I'd give it a 2. Now I'm going to listen with the bell of my stethoscope for any bruits. Okay, the other side. Alright, everything sounds good there. Now I'm going to palpate your trachea. Tell me if you feel any tenderness. Nope. Alright, then I'm going to inspect your thyroid, so could you swallow? Okay. Everything feels good there. And now I'm going to check the rest of the range of motion of your neck. So could you look down and look up, go side to side. Also, could you push against me? All right, and this side. All right, and that's checking for your cranial nerve 11. So everything is good there. And now I'm going to check for your lymph nodes. So we're going to start with your preauricular. So we can feel any tenderness. All right, posterior auricular, occipital. All right, and we got submental, submaxillary. All right, and the retropharyngeal is really deep, so we're just going to search for your superficial cervical. Nothing there. All right, and your deep cervical is deep within your neck, and then the posterior cervical, nothing there, and then the supraclavicular. Everything feel good?
Yep.
All right, well, you're good to go.
Thank you. My name's not Freddie. Okay, today we're gonna assess your chest for respiratory. First, I'm just going to state the rate and rhythm, which I already took previously, and it was 18. And your rhythm is very regular, not deep, very normal, no shallow, no labored breathing. Okay, now we're going to inspect, and I would have you not clothed so that I could clearly see your skin to assess for any lesions, any discolorations, any swelling. So that's kind of the thing we're looking for. I'm going to assess the movement of and the symmetry of your breathing. So if you'll do me a favor and just give me a nice breath. Okay, everything's even there. All right, now I'm going to palpate your chest for any tenderness and for tactile firmness. First, let's do tenderness. Can you tell me if you feel anything, any pain at all? Nothing? Nothing? All right. Okay, and now we're going to do the tactile firmness, which I'm going to have you say 99 whenever I touch you with my hand.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
All right, and that's good. Okay, so next I'm going to auscultate both sides. Okay, and if you'll take a deep breath every time I touch. Okay. All right. Next, I need to inspect your back. If you'll stand up for me and turn around. Okay. So I would look for any lesions, any swelling, and any discoloration again. And now I'm going to assess for movement. So if you'll again do me a favor, just take a nice deep breath. Okay, and that's symmetrical. So that's good. Alright, now I'm going to palpate for the same thing I did in the front for tenderness, so let me know if there's any tenderness. Nothing? How about down here? Alright, okay, now tactile firmness again, so 99 when I touch.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, now I'm going to auscultate for the breath sounds in your back. Listen for any adventitious sounds. Alright, take a breath. Okay. Alright, next I'm going to auscultate for 3 tests, bronchophony, whispered pectoriloquy, and nagophony. First with bronchophony, every time I touch, if you will state 99 in your normal voice.
99, 99, 99, 99,
Okay, and for whispered pectoraliquid, please whisper 99 every time I touch. Okay, and lastly, for agathony, say E.
E, 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 E.
Okay, and whenever I listened for your abnormal breath sounds, I was listening for wheezing, which is a high pitched musical sound, like a squeaking. Whenever I listened for rails, it was for a high pitched crackle, and ronchi is a lower pitched snoring sound. Right off, but go ahead. Okay. Oh, Bobby. Okay. All right, now I'm going to assess your cardiovascular, and we're going to start by palpating your chest wall for thrills and pulsations. So I'm just going to use the base of my fingers, and I'm going to feel for anything like a vibration. Okay, and I don't feel anything. All right, so I'm going to feel for it in the 5. Don't worry about cutting it off. I gotta start over though. Okay. I forgot that we're supposed to. We didn't do that in checkoffs, but I forgot we're supposed to do that for the video. Okay. All right. Now I'm gonna assess your cardiovascular, and I'm gonna start by palpating your chest wall for any thrills and pulsations, and I'm gonna do it in the 5 traditional areas of palpating, auscultating, everything. All right. So right here would be the aortic. Yeah. Right here's the aortic. Then we got pulmonic, and then we got Erb's point, and then we got tricuspid and mitral, and I don't feel anything there. Okay, now I'm going to auscultate. First I'm going to do with the diaphragm. The diaphragm's going to hear any high-pitched sounds, so we're going to do that same order. I'm doing that same order. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Alright, now I'm going to switch to the bell and do the same. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay, and you have 2 heart sounds. S1, which is heard louder at the S1 is heard louder at the apex, and S2 is heard louder at the base. So S2 is up here, and S1 is going to be down here. Okay, next I'm going to auscultate for your apical pulse, which takes a whole minute. So alright, your apical takes a whole minute, so I'm going to auscultate, and if you will just be patient. Alright, I got 92, and it was very constant. I didn't hear any murmurs or anything like that. Alright, now I'm going to palpate along both sides of you. I'm going to palpate for all of your pulses. Okay, so first I'm going to do radial. Okay, and radial for this side. That's a good, you're about a 2 in, what's it called? 2 in what? Force. You're about a 2 in force. Your ulnar is about a 1. Okay. And if I can get you to lay back, we're going to get your femoral, which is about a 2. And I forgot your brachial up here. That's about a 2. 2. Okay. Now I'm going to come down popliteal. It's kind of deep. Alright, that's about a 2. And same for this side. Okay. And posterior tibial. That's about a 1. And dorsalis pedialis. That's a 2. And then we're going to do the same from this side. 2. And a 2. Alright, and that's all that I need to do.